You could just put yours up,
Jerry and Carla.
you know, when it's your time to present.
Page on the.
Oh, that might be a lot. Should we do both?
Child support.
Yeah, there should be like an HDMI cable over there. Oh, yay.
You're doing the, for our committee, you're doing the first part. right?
I love that you hide the cord too, so someone can't take it.
Light up.
Dramatic symbol.
You know, I thought I was crazy, but I read the minutes, and a month ago, they didn't want to put in vaping.
Really?
Yeah. And
Okay.
There was
For the input?
because I couldn't believe when I asked at our other meeting at the mental health, and they said, yeah, vaping's in. So they've done it. That's good.
Well, I think it's, if vaping products have tobacco in them, or is it,
Right,
the key is tobacco access below 20.
yeah. So
We gotta wait for Mike
that's
to show.
changed, so that's good.
I had to reread the proposed tobacco laws to try to sort that out.
Right.
Push a button back here.
Over here. I think it's that one.
I felt like Vanna White there for a second.
I can sit over there.
It's exactly what I thought when I saw you standing there.
No? You have to hold the,
I'd
Myron.
like to
I
find
held
out.
it. Da-da-da.
One that plugged in anywhere? Yeah, that's what I thought.
Oh,
There. Okay.
yeah,
Beeped. Okay, it's
Oh, you
coming.
mean the one on the far?
right, yeah. I
thought it was an
made a
on-off button.
copy from
The one way here to the left?
Is it this one here or
what you
this one here?
submitted, what you sent.
button.
You want me to?
Yeah, that's what I was holding.
Yeah. We're good.
Yep, yep.
All right,
The thumb might be too big.
we will call the Public Health and Human Services Board meeting of Tuesday, November 19th to order. Anyone that has tuned in, we apologize. We were having multiple technical opportunities of learning happening this morning. That's what we're going to call it. And we will start with the approval of the consent agenda. Is there anything anyone would like to pull? And I do need to add, since the meeting agenda is under the consent agenda, we do have an agreement that needs to be added under items of board action, if you're willing to approve that. And you all have copies of that agreement. Could I get a motion?
I'll move to amend the agenda to add the agreement and
And approve the consent?
approve the consent, yes.
Thank you.
Support.
Myron seconded that. Any discussion? All in favor?
Aye.
Any opposition? That was all ayes, Sarah. And then we have a little introduction today of a new staff up in Public Health and Human Services. Anna, good morning.
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 Welcome.
Welcome.
Would you like to tell us a little bit about yourself?
Sure. I'm Anna Axtell. I'm the new adult mental health case manager. Before this, I was an employment counselor for AEOA, and I'm really excited to be in this new role with Public Health and Human Services.
That would be two that we stole from AEOA. Are we going to be in the naughty list with AEOA? Thank you, AEOA.
Yeah, it was a nice borrow. Anna first day was yesterday, so she's brand new and she's going through the training, and she just has some really natural qualities to work with people, and we're really excited to have her on the team, and I'm so thankful she's available to be with us. So now, again, our team is complete, and we hope to keep it that way for a long time.
And
Thank you.
has AEOA replaced you because they are part of our team? Good.
They did.
Yay! Then I won't feel so guilty. Thank you. And we will move on to our staff report from Allison.
Good morning.
Morning.
All right. So I'm going to present an update on economic assistance, our caseload, and which includes all of the food support, cash programs, and our healthcare programs. All right. So the various programs and services that we administer include the child care assistance program. And of course, everything has an acronym, so included the acronym there. CCAP, we have Cash Assistance for Families, that's the Minnesota Family Investment Program, MFIP, and the Diversionary Work Program, so those two programs. There are cash assistance programs for single adults, so you're not looking at minor children in the home. That includes general assistance, that's GA housing support, which was formerly known as GRH, and Minnesota Supplemental Aid, which is MSA. We also administer emergency assistance and the healthcare programs, which include medical assistance, Medicare savings programs, long-term care services, and a healthcare access program. It's a reimbursement program for those on medical assistance. And the federal program, SNAP, which is a supplemental nutrition assistance program.
Do we have an update on SNAP yet for funding?
No updates. You're referring to the potential changes to broad-based categorical eligibility. What I do know is that they extended the comment period by an additional 30 days based on information that wasn't initially included in the impact report. I don't have any updates since then, but I can.
That's very nice to
see what
extend the
Google has
comment
to
period,
find.
but that extends our waiting to find out what's going to happen. All right, sorry, Allison.
No, good question.
Thank you.
So the population served by these programs include county residents and residents who are in placement out of county. They were residents prior to being placed. People can remain on our caseload and remain the financial responsibility of Cook County while receiving services out of our county. The population served still include all ages from birth until death, families, single adults, people who were employed, unemployed, those with disabilities and other incapacities. And the income eligibility varies greatly from program to program and is also very dependent on the household size. So usually a household size is equated with a specific income limit. Let's see here. I'm just looking at my little side notes. Let's see. Oh, okay. Okay. So in looking at, eventually here we'll be going into some graphs and some updated numbers on what our current caseloads are and what the trends have been. So in looking at the numbers for all of the various programs, caseloads have remained fairly steady throughout 2019, but after having gone through like a little dip at the end of 2018, and you'll see that on the charts as we go. And you can see that with SNAP, the family cash programs, and the healthcare programs. The single adult cash programs, which include GA and MSA, have remained at consistent levels with previous years. And then we'll also talk more specifically about our CCAP caseload, that's the Child Care Assistance Program. There's been a significant drop in that caseload. All right, so first one we'll look at is child care assistance, the CCAP caseload. So this would include families who receive child care assistance through one of the family cash programs, MFIP or DWP, or through the basic sliding fee program. So people don't have to be on another assistance program in order to apply or receive child care assistance. Program eligibility is based on household income, and it provides assistance with child care costs so families can either work or look for work. And usually the program doesn't cover costs 100%. Usually there's still an out-of-pocket expense for the families.
Do we know why the numbers are down?
So I have some theories. So Allison and I have talked about kind of like the trends that we've seen. So right now for the month, all of the numbers for these programs are through the month of October. Mm-hmm. So for the month of October, we were sitting at 4 cases. And with CCAP, you can have cases that are in basically two statuses. A suspended status, which means they're eligible for the program, but they don't currently have a provider, so the program isn't actually making any type of payments. And then the other type is an active case, which means that they have eligibility and they have a provider in which the program is actually making a payment to. I have one active case right now that's actually receiving payments through the program, and then the other 3 would be suspended. I have a stack of a few applications currently, but you can see from a year ago, we were sitting at 12 cases, and it's just kind of slowly gone kind of down since the end of 2018. So a couple of theories. Supply and demand, I think, is a big one. We've seen fewer providers over the last several years, and childcare isn't cheap, and so it feels like it appears that for the few spots that are available, especially when you're looking at infant care, that the individuals who get those spots are the people who can pay for those spots immediately. And so when those spots are filled, then we see those families who actually need the assistance, they can't get a spot. So then they don't apply. Because if they don't have a childcare spot, then there's no use applying for the program. I've also seen for the cases that were active previously, a lot of them have closed because they've actually gone over the income limits for the program, which is a good thing. The purpose of economic assistance programs is to lead people towards self-sufficiency, and that means exiting programs when your income then exceeds the program limits. So that's a great thing to see, but it still puts people in a bind. People are earning more income, but if they go off the program, now they're paying 100% for their childcare, which basically then is a huge chunk of their income, because full-time childcare is a little over $10,000 a year
Per kid.
per kid.
So the need may be down slightly due to a little bit of economic growth, but then I know of families who have just decided that one parent is no longer working.
Correct.
Because it's not feasible and we don't have the daycare slots open.
Correct. Those families that haven't been able to get a spot or afford a spot have left employment and are now at home taking care of their children and therefore no longer need the program. Or they're looking to return to employment. It's hard to find the spot.
So have our other assistance programs increased with the people leaving? Okay.
And I
No,
think
we've actually seen a decrease with the other programs too.
I think another way to think of this is that, when we had that higher caseload in the 20s, that a lot of those families, as Allison said, have either aged out of the program or earned enough income to no longer qualify for assistance, but that entry income limit is so low that it's just the low income wages that people are earning in this community are higher than
What they were.
the program's
Yep.
baseline income lit.
And is our birth rate staying the same?
I think so, but
Okay.
I would also add that this, what Allison mentioned about families choosing to stay out of the workforce or having to stay out of the workforce because of a lack of childcare was really reflected in the data from the listening sessions that we did in conjunction with the clinic and the school with parenting families who have had babies in Cook County in the last 3 years. That I think it was like 80% of the respondents through the surveys and the listening sessions indicated that childcare was a factor in their ability to re-enter the workforce.
And going off what Allison mentioned about some of these income limits, what we call the entrance level onto the program, the income limits can be fairly low. And I wanted to give you an example of kind of some of those calculations to really kind of really make that like black and white. So we're going to use an example of a 4-person household. So think mom and dad and 2 kids, right? Kind of typical situation. So for basic sliding fee, it's a lower entrance level than someone who's on a family cash program. So to enter CCAP, to enter the program, the family has to have income that's not greater than 47% of the state median income. So 47%, the 47% entrance level for a household of 4 is $48,893. So a family would have to have gross income under that amount. So let's take the $48,893 and divide it by the two parents, right? Let's say they're both equally working, earning the same hypothetical amount. So that shakes out to $24,446 per parent. Now, if you divide that by the full-time equivalency of 2,080 hours, that comes out to an hourly wage of $11.75. Now, we typically see, even in working with families on the other programs, they're earning an hourly wage more than that. I don't think there's many employers that would pay below that. So I think what Allison said too is, in looking at the wages that are offered here locally, we tend to see families already above that income level even when they apply and they're not eligible to enter the program.
Which isn't to say they aren't struggling with the cost of childcare and housing.
What would be the best avenue for us to give feedback to the state regarding regarding that threshold?
Yeah, I think CCAP is always a popular topic for legislative proposals and action, both within MAPSA and AMC. Unfortunately, it's more been the target of fraud and waste and abuse lately, so it's more on the regulatory end that we're seeing a lot of these changes, none of which are really increasing access for families. But I think that's something to have conversation with, within the policy committees at AMC. Here's how this is impacting access in Cook County. We have some kind of unique situations here with our lack of providers and what our low income wages for our community, but are still much higher than the program limits.
Yeah, and my impression is that it's certainly the wage is a factor, obviously, but I feel like not having childcare spots is maybe the larger factor. But
I think cost too. I mean, the cost is always relative to those situations. Excuse me. The only way I think that you could do this, and I doubt if it would fly at the state level, from my understanding, would be mathematically you would have to have a cost of living standard for a region like a county and factor that in. So
fiscal disparity for public health.
Yeah, but then you would still have to factor in availability, which then just throws it all off because that's a variable.
Yeah.
But I think what we can do is try to work hard to make sure that we have available spots for these people that need it.
All right, so moving on from CCAP.
yeah, that was graph one.
Huh?
That was graph one.
And that was one. Yeah. That was the biggest one, though. That was the hardest hit one. All right, so family cash, so MFIP and DWP, never mind because we just don't have the data for November and December.
Darn it.
I know.
It looks so nice.
We're still serving people. So in the month of October, we had 16 cases. So again, that trend that I mentioned before is kind of see that dip kind of in that last quarter of 2018, October, November, December, and still, well, I mean, still fairly consistent through 2019. But it's definitely less families that we've been serving. I think as the economy has rebounded, has grown. Let's see, food support, so SNAP, kind of similar trend. We're serving right now 109 family units in the month of October, also down from kind of like the last quarter of 2018, where if you look at 2018, we were in the 130s, even up into like the 140s at one point during the year. Now we're kind of in that like 110 to 120 range. The healthcare programs, so medical assistance and a Medicare savings program. So the Medicare savings program is a program to help cover the cost of Medicare Part B premiums. So at least we got a really tight line there. But again, there's still a slight decrease from the end of 2018 going into 2019. We're currently at 567 cases. So again, you can kind of look at it as like a family unit, down from up in the 600s during 2018. But still, again, a fairly tight range throughout most of those years. So snapshot of October, so kind of breaking it down into kind of like how many people are we actually serving and assisting with these programs. So right now, or in October, we were serving 166 people through SNAP. The average benefit per person was around $98 per month. That's pretty significant. Roughly 28% of SNAP recipients have earned income, and about half of the SNAP recipients receive retirement or disability income, so a form of unearned income. 16 families received cash and food assistance through one of the family cash programs, MFIP or DWP. That included 15 adults and 34 children with an average benefit of $221, a little over $221 per month. And over half of our MFIP participants are actively working and have a source of earned income. 27 adults without children, so those single adults, were receiving cash assistance through GA or MSA. The average benefit per person for GA was almost $185 per month. And for MSA, it was a little over $92 per month. MSA is a small supplement for those that are receiving SSI. So not RSDI, but SSI, the benefit amount is smaller with SSI. And GA is, the max benefit is $203 per month, and that is more of a temporary assistance program. We kind of refer to it as a stepping stone as we refer people to apply for other benefits, other permanent benefits like Social Security. And then looking at the healthcare programs, we had 948 people eligible for medical assistance. And we have 83 people receiving help paying their Medicare costs through one of our Medicare savings programs. All right, looking at emergency assistance, we provide emergency assistance for persons in jeopardy of losing something that is of a basic need. So think heat, electricity, or shelter. The assistance also could be available to resolve lack of shelter or support a cost-effective move. So basically, someone is currently homeless and they have located permanent housing. That program can also assist in those in paying like down payment and first month's rent. Funding is limited. Typically, the average allocation for a family crisis funds are $5,000, and then we have a separate fund for single adults, which caps out about $1,000 per year. So far through the month of October, we have issued close to $2,000 in our family crisis funds. We actually just issued a little over $600 last week, so that would be in addition to the almost $2,000 that we have issued up through the month of October. And then we've issued $795 in general assistance funds. Again, that's for single adults. So 4 households have received assistance, which includes 5 adults and 6 children. And we've helped prevent utility disconnects. We've paid off past due rent to prevent eviction, and we've helped pay for someone to secure stable housing. So looking at our staff updates, luckily we've remained fairly steady, not many changes. We have 4 full-time workers working in all of the programs, so cash, food, and the medical programs. We have 2 computer systems, I guess if you want to refer to them that way, in which we do our processing for cases. We have kind of like what you think of the green screen, like MS-DOS, where it's all like functions and you just use the keyboard. That system is used for the cash and food programs and some of the medical assistance programs. We have 160 cases currently in that system, and that's just cases. So that could be like one person, but they're on 3 different programs. And then we have what's known as the MET system, or everyone likes to call it MNsure, and we have 422 cases in that system. So approximately, if you break down the number of cases per worker, Each worker is working approximately 145 cases. Again, one case could have multiple programs. And out of those 4 full-time workers, we have one worker, Agni, who is trained in long-term care, and she alone works on 49 cases just for long-term care. We also have our income maintenance case aide position who works out at the front desk, and she does a lot of support and extra processing that she's able to do based on security clearances, and she's also our healthcare access coordinator, so she primarily works with individuals to work on submitting the proper paperwork and forms to receive reimbursement for travel expenses related to medical services. Some program updates. So although our caseloads have slightly decreased, it has really allowed our workers to become more efficient in their processing, and we've been able to actually tackle tasks and other priorities that have kind of been at the bottom of the list over the last several years. So think processing cost-effective health insurance. So if someone has insurance through an employer or has access to insurance through an employer, we have to do a calculation to determine if the state can pay for those insurances. Just part of the requirements when they're on medical assistance. We've been doing more medical support referrals. Medical support referrals are child support referrals when children are on medical assistance and there's an absent parent from the home, that we have to actually make a child support referral for those cases. And we've also been able to focus more on doing overpayments, doing calculating claims and collections for individuals who received a benefit above and beyond what they were eligible for. And that again is a requirement in policy that has not been something we've been able to get to until recently. Some recent changes in policy and related to SNAP, we have been under what's called a waiver for the last 2 years, basically a waiver from a specific program policy, which refers to ABODS, another wonderful acronym, and that stands for able-bodied adults without dependents. So people who are considered an ABOD, so think ages 18 to 50, and they don't have a dependent in the home, and they don't have an incapacity to work, right? So they have an ability to work, right, and earn income. So under a waiver, these individuals could just keep receiving SNAP and not be subject to finding work or retaining work. This waiver has since been removed starting October 1st of 2019, and so we're kind of having to refresh ourselves on how to implement this policy again because we've been under a waiver. So now that we no longer have a waiver and we're implementing policy, these individuals are actually limited to the amount of months that they can receive SNAP if they don't meet specific work requirements. So again, policy change that we're having to relearn, or for many of our staff learn, because they weren't working here in the agency when we initially went under this waiver. So
And
just
is
a
that-
little extra work, a little extra training on our part.
So is ABOBS a single person household?
It could be a married couple, as long as there's no dependents in the home and no incapacity to work.
That's a better reference to them than DINKs. Double income, no,
Yeah,
double.
ABODs. Yeah, we call them ABODs. Yeah.
ABODs is much better.
ABODs, yeah.
And Allison, you mentioned, I think, the reservation is exempted from that
yes,
as well.
good. I didn't mention that, but that's good, yes. So the county, besides the reservation, is no longer under a waiver. The reservation itself is still considered a waivered reservation, like many of the reservations throughout the state. They look at the unemployment rate to determine if an area receives a waiver. So Cook County, Lake County, and St. Louis County, the 3 counties actually lost their waiver starting in October 1st of 2019. So staff from those 3 counties are relearning and having to re-implement this policy after not having done it for 2 years.
Because our unemployment rate was low?
Yeah, I guess low enough. Yeah, I'm not sure what the rates were, but that's what the federal government looks at to determine if an area can receive a waiver or not from that policy.
Yeah, they're gonna have to look at that again, because the whole state is gonna be short 250,000 people for jobs in the next 5 years, so that factor's gonna have to be adjusted.
And they reevaluate that every year. And then another big change with policy is in regards to individuals who receive medical assistance under an aged, blind, or disabled basis. So anyone over the age of 65 or blind or certified disabled, those individuals are subject to an asset limit when they apply for medical assistance. And the state has since implemented, starting September 1st, a new policy as kind of a double check for the assets that they're reporting. We have to run their information through a program, a new system called the Account Validation Service. And this is actually a federal mandate that the state is now implementing to be in compliance. So basically, we have an individual's name, social security number. We have to get a new authorization form that allows us to acquire their financial information through this service, we call it the AVS, Account Validation Service. And that's, again, it allows agencies to double check and cross-reference information that comes back from accounts that they hold with financial institutions, so think checking and checking account, savings accounts, and so we can compare it with the assets that they're indicating that they have on their applications. So just one more step in the processing that we have to do with clients and people who are looking to apply for medical assistance who are subject to that asset test.
And I would just add there, want to recognize Allison and her team, as well as the care coordinators within our adult and home and community-based services team. They're really doing everything that they can to communicate up front when a person is at risk of losing their medical assistance eligibility, really coordinating how to help people get those forms in so they don't lose assistance, have to reapply, and are at risk of losing some of the essential services that they receive through their waivers. So again, one of the benefits that we have of being fairly small, in that we can really support people in maintaining their eligibility up front. It's a little bit extra work to communicate, but it saves a lot of time for our team and a lot of stress for program participants in not losing their assistance. So thanks, Allison and Martina and team.
Just some other graphs, because graphs are really fun to look at. Our performance goals, so percent of SNAP and cash applications processed timely. So processed timely means within a 30-day time frame, and that is standard amongst the food and cash programs. Healthcare programs have some different guidelines, but here's a graph of where we are year to date. That is through August of 2019. That's the most current information we have. So of all of the applications that we have received, we have processed a little over 97% of them within that required 30-day time frame. As you can kind of see, back to 2012, kind of see that trend. In 2016, 2015, 2016 is kind of where we found ourselves. It was before
Don't
we
point
had.
at me, Allison.
Well, we were both here. It was pretty much just you, me, and Andrea at that time, I suppose, and Pat. So
It was
we have made
staffing.
significant strides in staffing since that point, and clearly we can see the outcomes of.
And it
of
wasn't
doing
that staffing wasn't doing their work. We didn't have
We
enough
didn't have enough
staff
staff.
to do the work.
Absolutely.
And so everybody was doing everything. I mean, those were the years when there was cars in the parking lot until 8 o'clock at night.
Yeah.
Trying to keep up. And so it wasn't that the staff wasn't qualified, competent, or doing their work. It was that we did not
just were
staff
overworked.
enough people.
Yeah. There wasn't enough staff to address all of the concerns and casework that needed to be done. So unfortunately, our timeliness in processing applications also took a hit during that time frame. But again, we've rebounded as we've added staff, and the staff have become experienced. A couple staff have already been here for over 3 years. That's fantastic. And,
Yeah, we're going to get a nice, happy letter from the state, I'm sure.
Yeah, hopefully. Yeah. And here's kind of a breakdown of performance goals for expedited SNAP. We have different processing requirements. If someone is screened as expedited, which means their current income and expense situation would put them at a need to receive benefits basically immediately. They don't have the resources to afford that food, and so that's why they can qualify for receiving benefits within, we try to process within our agency within 24 hours. The state has different guidelines, so they look at 24-hour processing. 5 business days is basically the time frame that the state looks at to see if we are in compliance and meeting our timeliness processing, and then up to 7 calendar business days. So we've had a total of 27 expedited applications, and we've processed 23 within 24 hours. And again, the standard that the state is looking at is within 5 business days. We processed 25 of 27 for a total of 92%. And sometimes there's just factors that are out of our control. We're unable to get a hold of the individual that applied, so we're not able to do an interview or talk with them or issue benefits within that specific time frame. So unfortunately, things do happen, and we can't always get 100%, even though that's what we strive for.
So on the 85% in the 24 hours, I know that in some programs, when we hit a certain threshold, we get a letter from the state of our improvement plan.
Mm-hmm.
Are we okay in that range since the state requires a 5-day?
No. You're like, you know what's coming. So in one of the screens here later,
Yep.
I'll talk about our
Okay.
SNAP ME review, which is part of looking
Yeah.
at our timeliness. Yeah.
And in terms of earning any performance bonuses, that happens on a statewide basis. So the whole state has to meet a certain standard for us to earn additional funds. You might remember a couple years ago, we had some funds that we used to purchase headsets, I think, for our staff.
3 years,
so that
4
they could.
years, yeah.
They spend a lot of time on the phone during the day. So again, we're dependent on improvement of the state as a whole to earn those additional bonus funds. And that's where things like changes to broad-based categorical eligibility, which change policy, requires new training for staff, can really have an impact on our statewide performance in terms of meeting those goals.
Okay.
And someone told me too that the federal government isn't doing any SNAP bonus allocations, so, bummer. Yeah, we like extra money too. It's a surprise, that's always good.
And I don't like performance improvement plans that do not pertain to our area due to our uniqueness.
But
There's
they're
my
a good learning
politically correct way of
opportunity,
stating that.
All right, so this came directly from DHS in a report that we got. This is our MFIP and DWP self-support index. So this is mandated by the Minnesota legislature as one of the ways to measure the success of the programs. So it looks at every adult receiving MFIP or DWP in a quarter and counts how many are off assistance or working at least 30 hours per week 3 years later. Beyond that, I couldn't explain this any further, probably. It kind of is one of those things that if the state says we're doing good, then that's good. We'll take it. So within, let's see, I know it's small. We are within, for 2018 to 2019, and so this is looking at the period of April 2018 through March of 2019. We are sitting at 82.64% for our self-support index, which is within the range that they are looking for. So we're doing good.
And
No
this-
improvement plan.
And the success in this performance measure is also dependent on our work with employment services. So Anna, who was here this morning, was previously our employment services case manager. So we've done a lot to really improve communication with employment services, regular monthly meetings to check in on caseloads. Are people having barriers to self-sufficiency that we can address, make a referral? As well as, in addition to AEWA, we work with the Minnesota Chippewa tribe for enrolled band members to receive services through the tribe. So again, this speaks both to our staff as well as those employment services agencies.
Part of why I asked if the spot was filled. Because we need them.
Yeah, absolutely. All right, so looking ahead, staff development, looking to send one of our MFIP workers to CCAP training after the new year. Currently, I am the only CCAP caseworker. Granted, right now it's not a really large caseload, but that's kind of the perfect time to also get someone else trained in and transfer and hand that off. And that will kind of free up my time too, not having a caseload to work on. And then Kathy Ann, who was hired back in February, she's already gone through SNAP training and healthcare program training. We anticipate starting her with long-term care training, usually about a year and a half maybe after going through the healthcare training, kind of build that experience, so maybe late summer, early fall of 2020, but again, looking to have 2 individuals working with those individuals receiving long-term care services. All right, Heidi, you asked 2019 SNAP Management Evaluation, we call it our SNAP ME review. So during the summer of 2019, DHS staff reviewed our SNAP cases. They took a handful of cases, I think there was about 20. They reviewed those cases to determine compliance with performance outcome measures, which recognize our agency's strengths, and to find areas where improvement would be needed or maybe some more ongoing training internally, just a reminder of policies. The ultimate goal is to improve services and achieve the best possible outcomes for people accessing these programs. So based on our review, there were areas of focus and deficiencies that were identified. So I did submit a corrective action plan, which included some processing for expedited SNAP and some other things too. The DHS did review and approve that, and so we are starting yesterday. We'll be doing a lot of internal reviews and a lot of internal reminders and training, just to ensure that we are implementing and applying policy accurately for this is specifically for SNAP, but it's a good reminder for all of those programs. Our financial workers work in all programs, which is not an overly common thing in the state. If you go to any of the other counties, think St. Louis County, you have a worker focused on one specific program. Like, all they have to know is SNAP. And so it's only natural that there could be just deficiencies in applying policy, as there's a lot to retain and a lot to remember and know when we work with cases in the different programs.
And if you go back one slide and look, St. Louis County had a couple sections of red. So just because you have staffing doesn't mean that you can meet all the criteria.
Correct. And even if you work in one specific program, you're still going to miss things. It's just the nature of humans and our work. Yes?
Thank you. I'm a little curious about corrective action plans. What do they encompass? What do they focus on? Is it sort of like correct something, or is it going to be working for preventative measures?
Yep, so kind of all of those things. So DHS provides us a framework to develop that. So based on their review, they identified the deficiencies that we need to correct. And so they identified those deficiencies in kind of this framework, kind of template corrective action plan. And so then I have to review those deficiencies, and I have to identify, well, how are we going to address them? What type of training, what type of reviews are we going to do? What are the processes that we're going to do internally, basically over the next year to 2 years, to help correct those and to prevent them, hopefully, going forward? And then what are we looking at as the ultimate outcome? And so some of those things would be internal trainings, reviewing cases in which we identify a deficiency. I'll be doing case reviews, so I'll be actually selecting cases to review them to make sure that through this process we are reducing those deficiencies as expected.
Yeah, good. So in like development and training and so forth, does it get at staffing levels? That's where I wanted to go with this. That would there be indicators saying that, this is a staff issue or it's a development issue?
I wouldn't say it's a staffing issue. I think we have a really good, we've got a good level with staffing, and experienced staff at this point too. So it's just kind of reminding and retraining ourselves on policies. And as we talked about earlier, policy is always changing, like this removal of the ABOD waiver. That's a whole new policy. It's not new, but it's new to us because we're having to now implement it. So throughout the years, as policy changes too, it's just natural that there's going to be deficiencies because it's easy to forget that something changed, or to remember that we need to apply something differently than how we previously did it. So it's more focused on internal training.
Well, it's good to know at least we as a board are doing our part in staffing.
Yes,
Good.
yes.
I don't think the state would tell us to change our staffing based on corrective action. That would be up to us as department and board to look at it and figure out how we fix it.
I guess I was asking for indicators
Yeah.
of staffing issues, and you're saying there's none.
Yeah, I wouldn't say there's any
Thank you.
indicators that we need to address any staffing at this point.
Okay.
Historically, though, that was definitely
Yes.
a factor in reporting on corrective action plans and performance improvement plans. We just don't have enough people to do the work.
Very aware of that.
So that's a change within the last several years.
It's not an easy change.
And again, one of the benefits of these positions is that they are essentially funded at 50%. So it's just finding that right mix of staff, and then we can bring in the revenue to support having that balance of enough people to do the work.
Thank you.
There were a couple of fund plans that had to be developed and submitted to DHS for review and approval. That included our child care assistance fund plan for 2020 and 2021, and then our MFIP biennial service agreement. Both of those plans have been submitted. I think late summer they've been submitted, and we are still waiting to hear back if they have been approved by DHS. Let's see here. Policy reviews. So just within our internal policies and some of the programs that the county actually funds and administers, not on behalf of necessarily the state or the federal government. We have our county burial, and that policy was revised and approved in March, and that was a really huge step and really helped clarify that, how we process those applications. That policy was, I think, like 11 years old, hadn't been revised in quite a while. And then looking forward, I'm hoping to review our emergency assistance, our crisis funds policy, which includes our family crisis funds and our single adult crisis funds. And that as well, I think, is 9 years. I think maybe 2010 was the last time that those had been reviewed. So trying to address some of these kind of maybe potentially outdated policies, or making sure that they include some of the most current policies and procedures that we look at.
So
to
now
help
that you're
determine
seeing that
eligibility.
some of them are older, do you have like a policy plan where every 3 or 5 years there's certain policies you just review?
That would be great
That would
to
be
be
good,
on
yeah.
that kind of a schedule. At
I
this
haven't
point,
thought
again,
of
we're
anything
still
like that yet. Yeah, it's
we're
just
still
like
a bit in catch-up mode.
trying to
so-
tackle things as we identify.
But now that
these
you're catching
needs.
up, just like
Yeah.
put together an Excel sheet or whatever.
That's a
And
good idea.
I know you've done that on the safety committee for us to remind us.
Yeah,
I know she
But
has
that's
the
a good-
skill set to do
That's
it.
a good idea. I like that. I haven't thought about it. It is still kind of like we're kind of in some of those catch-up modes now because we are stable. And so just hoping to identify some of those outdated
We
policies.
did that in land services. You know,
Mhm.
once you start to catch up, then you're
Mhm.
like, okay,
You're like,
now.
"Oh, I wanna do this now."
Yeah, and
Mhm.
just getting it on a schedule.
And there's always continuous software enhancements, and those, again, either cause more work or help create efficiencies in our processes too. Again, the big one is the account validation service, that new asset check that we're doing for those individuals with an asset limit on medical assistance. So that was a whole new software program that we had to learn. There is still, the DHS is still working on a software program for appeals throughout the state of Minnesota, if there's appeals for the assistance programs. And then METS or MNsure, as we all know it, is always undergoing enhancements. And that program has come a long way and has become quite more efficient. There's still a lot of work to be done, but every improvement that they do makes our job a little easier and benefits the clients too. So that's just looking ahead.
Next time that I get a software update, I'm going to call it an enhancement,
An
so
enhancement.
it sounds better.
We've
We
been
hope that
drinking
they
the
enhance,
DHS
yes,
Kool-Aid.
Any questions for Allison?
That's great.
Thank you.
Thank you.
Thank you.
You're welcome.
All right, let's move on to director's report.
Just want to echo, thank you, Allison, for your great report. Nice
Glad to be here.
updates. Thank you, commissioners, for your great questions. Agency staff updates, rather, start with staff updates. We just have one update. Anna Axtell is now on the team as our adult mental health case manager.
Oh, let's
Is there something going on today, or what?
Watch TV, right?
It looked like it was breaking news.
Everybody stop what you're doing.
I'll be brief so we can catch up with whatever is happening. But so that's it for staff updates. Again, we're fully staffed and hope to be in this place for a very long time. Agency-wide updates in your consent agenda this morning was a financial report for year-to-date 2019 through October. Our collections have increased since the last monthly report, and that is due to receiving the second half of property tax payments. Otherwise, everything is as we would expect for this point in the year based on delays with our billing and receiving of revenue. I received a notification from the DHS commissioner just yesterday regarding several issues that are likely to have a significant impact on counties, and wanted to share this breaking news with you as well, what I know and what I don't. Issue number one is related to the county share for IMD payments. So these are facilities where persons have a dual diagnosis of substance use disorder and mental illness. One of the ways that those facilities are funded is through a combination of state, federal, and county funds. DHS, for a time period, estimated the county share for payments to these facilities, resulting in overpayments. So DHS will be billing counties for the difference of what should have been owed to these facilities. This is a part of DHS's organizational redesign, looking at overpayments, who's responsible, what were the issues that caused these. So this is just one piece of that. Compared to other counties, the fiscal impact to Cook County is quite small. So we're very fortunate in that regard when you look at the millions of dollars that other counties are facing, having to repay. Our estimated impact was right around $2,000. So again, that's something that if we're required to pay in 2019, we're under budget in our out-of-home placements. It should be no problem to address that unbudgeted expense in 19 or in 2020. So again, the state in their memo mentioned that they would be working with counties on addressing a payment schedule for some of those more harder hit counties. Issue number two is related to Title 4E payments. 4E is the federal reimbursement mechanism for foster care. The specific issue is related to some congregate care facilities, so residential placement for children. The issue was related to the implementation of the Families First Prevention Services Act. So that's new federal legislation related to funding for out-of-home placement for foster care services. The goal of this legislation is to move the funding further upstream in preventative care, but some of the impacts that's having is on those more deep-end services like foster care settings. So the implementation required enhanced background studies for some of these facilities. The guidance came out from DHS on July 1st, 2019, which was the effective date of the policy change. So there wasn't enough time for facilities or counties to address that implementation schedule. Again, the impact for Cook County is minimal because we haven't had many kids in foster care this year. We don't have the exact number, or we don't have the estimated impact for Cook County, but based on what we know, that the effective date was July 1, at least for the last several months, we really haven't had any kids in residential placement, that it's not going to be a significant impact for us. But other counties, again, are looking at having to return 4 e-claims that they received for that time period when it was ineligible. Issue number 3 is related to cash assistance overpayment recovery. So Allison in her report this morning mentioned that because we're fully staffed, because we're caught up, we're able to actually fulfill our obligation in collecting on overpayments. So when an individual, a family, receives more assistance than they should have, policy was applied incorrectly, then we are required to recoup those payments if they received benefits that they weren't eligible for. In 2016, a new law took effect that exempted certain overpayments from recovery. So when the overpayment was caused by an administrative error, meaning the agency, the state, the tribe applied policy incorrectly, and that family received assistance or that individual received assistance they weren't eligible for, those overpayments were exempt from recovery. This was one of the more vague issues in this memo that came out yesterday. The DHS wasn't clear on what the incorrect guidance was that county received, only that some people were incorrectly cited overpayments, and those will need to be reversed. So again, we're estimating not a significant impact, but there may be some additional work for our staff to go back in and address overpayments that were incorrectly cited.
Great.
Yeah. But again, benefit is that minor impact relative to other counties. But a lot that we still have to learn about what the issues were and the schedule for implementation and payback. Also in your agenda packet was a notification, this is for your information only, related to the closure of a performance improvement plan for child support. So when Dan Plinsky was up earlier this year, he gave a report on the child support program that Carleton County has a contract to manage all of the cases for Cook County. He also shared at that point that we are under performance improvement plan related to establishment of paternity. Again, this is another area where our small size is a factor in performance, that it's really difficult for us to get above that threshold. But based on the last time frame of performance, that was closed. So he and his staff are no longer having to do the monitoring and reporting as we're above that threshold. Lastly, before I get into the budget and staffing updates, we had 3 staff members in PHHS go through the ACEs cohort training last week. And that was put on by the clinic. They organized that training. So 3 staff from our agency, as well as a number of members of our newly formed local advisory council for mental health, also went through that training. We are in the process of scheduling a training for all PHHS staff. So the purpose of this training was a train the trainer model. So everyone who went through this 2-day intensive training now has the ability to go back to their organization, their community, and kind of spread the message and continue that ripple effect of having conversations about adverse childhood effects, how they show up. What does this mean for Cook County, and how can we be a more resilient, self-healing community? So we're really excited to have all staff go through that, and really want to express gratitude for the clinic in providing leadership in that area, bringing the training here, and everyone who was able to participate in that. Yes.
Would it be okay to know who those 2 people are?
Yes. So Grace Bouchard, Children and Family Services Supervisor, went through the training, and Matthew Baxley, who is our community support provider, went through the training. They'll be providing that training to PHHS staff. Grace Grenager also went through part of the training as well, our public health coordinator.
That'd be a good first Thursday conversation on WTIP.
Yeah. That's a great suggestion.
I think I was talking with Hartley Cyril the other night, and it was what, 30 people went through that in the county, I think?
Yeah, I think there were 24,
24,
23,
okay.
right around 30 though. Yep, and we had people from outside the community come to attend the training as well. So that just goes to
That's
show
great.
the interest and demand for this type of information. And we'll have, we'll follow up at our next local advisory council as well to talk about from the perspective of the community members who went through that training, how do we want to continue to keep this momentum going. So I'll move on to the updates to our 2020 budget and staffing. In your packet, there was a narrative summary. There was the first page of the budget to show impacts on major program areas, and then an updated organizational chart reflecting the proposal for 2020. So again, these changes, as I've shared at our last several meetings, don't impact the initial levy request for PHHS. It's moving funds around within the budget. And based on some savings from our initial budget submitted in August, we had significant healthcare savings, again, based on our initial guidance to budget 10% for our health insurance. We're a large department with lots of staff, so when the actual number came in, that was a significant savings for us. Initially, when we presented, Lori and I, in August, we had proposed one new position that was split funding and programmatically between social services and public health. That person would have been providing treatment coordination services, which is one of the new services authorized through the substance use disorder reform, as well as providing some health education in the area of substance use prevention. Again, this is something we identified in our community health assessment and improvement plan as an area where we needed to add capacity within our agency. Later on, we have looked at adding a daytime crisis response, formally taking that on as an agency. This is something that has been a significant gap since the closure of HDC last November, something that our staff have taken on in an informal capacity when someone is having a mental health crisis during the daytime. Often our intake worker or that individual's case manager are working to respond to the crisis, often in conjunction with law enforcement or with hospital ER staff. We do have dedicated after-hours crisis response that's provided through a regional contract with HDC. So that gap is during the daytime. So we are proposing a full-time position within social services to provide that treatment coordination and the daytime crisis response. Both of these having the potential to access revenue from the state once we're certified to provide those services. With the public health position, initially we had looked at funding a half-time public health position, and then we are also in the process of applying for a grant through the Robert Wood Johnson Foundation that would allow us to take on that housing work within the community, working with other government agencies, working with healthcare providers, economic development, all of the people who have an interest or are already working in the area of affordable housing, but also really looking at this from a health equity lens. How do we work with the people who are most adversely impacted by housing insecurity and making sure that their voices are a part of any planning and solution? So again, in our most recent adjustments, we are looking at fully funding that second public health position. We have the funds within the budget to do that. And regardless of whether we receive that grant fund from the Robert Wood Johnson Foundation, that would just be additional revenue to us, and we won't learn until later next month if we receive those funds.
So do other counties have a position similar to that?
No, but this is a function of other counties' public health departments. So, for example, Carleton County, one of their public health coordinators started a housing coalition. I was actually involved with that through a school project through the Humphrey School. So I got to learn a little bit more about their coalition, where they're bringing together other agencies within the community to talk about housing and solutions to increase affordable housing.
Okay.
But again, that health educator position, It would be reporting to Grace. You know, historically, we had 2 public health nursing positions. We did not fill that second position as we were transitioning the family home visiting program to the clinic. And now we feel like we're in a place where we can fully support 2 public health positions, but just a slightly different structure with, rather than 2 nurses, having that coordinator and then a health educator also working with Grace and supporting some of her work. What that person would be doing would be very much driven by our health assessment and our health improvement plan. What were the priorities that were identified for the next 5-year period by the community, by our agency and the partners that we work with. So things like behavioral health access, supporting families with young children, supporting elders in the community, affordable housing, substance use disorder prevention education, access to specialty services. I think that's all 5.
I'm just trying to figure out how we're going to make that job description.
We have, we've started the work. We have examples from other health departments. We are quite unique right now in that we just have 1 person working in public health. So many of our public health services are provided through a contract. That's a huge piece of Grace's job, is kind of managing and coordinating all of that, in addition to emergency preparedness, in addition to the community health work that she's been leading. So having more capacity in that area is really just going to increase the good work that we can do in that area.
Absolutely.
Well, yeah, talk about ways to continue the momentum of the ACEs training.
Mm-hmm.
I mean, what a good way to make our community more resilient and prevent adverse experiences.
And that's something that I've been hearing quite a bit from our Children and Family Services team as a major gap right now is parenting education. So could this person also have a role in working directly with individuals in addition to more of a community population health education?
Awesome.
So those updates are reflected on the organizational chart. You can see in the dashed lines that those are proposed. Again, we do have the funds within our 2020 budget to support both of these positions. We haven't budgeted the revenue for these positions because we don't know, for example, if we'll be able to hire someone, specifically for that treatment coordination position, if we'll be able to hire someone who already has all of the requirements, including the clinical supervision or the number of supervised hours of experience. So we aren't budgeting the revenue. We still feel like this is an important service to provide, regardless of whether or not we can capture that state revenue.
Allison, what's involved in becoming certified to provide the daytime crisis response service?
A number of things, and we're still learning a lot about that, but it has to do with the credentials of that individual. Do they have the educational and practical experience to provide that service? As well as there's the clinical supervision piece, so they would have to receive oversight. We're looking at a few different options. Our adult mental health case manager and children's mental health case manager receive clinical supervision from the behavioral health consultants at the clinic. In the area of crisis response, that's kind of a different model, a different system. So we're looking at whether we can tap into one of our regional resources, potentially HDC, potentially the Thrive, who runs the Birch Tree Center. There are a few different options that we're pursuing to see if there would be interest in supporting us in entering this field of daytime crisis response.
So on the old chart, Grace G is already in this box, but on the new one, she's now going to have a staff. So do we have to change her job description?
Yeah, so assuming this position is approved, we would need to revise Grace's job description. She already does have, and I've had this conversation with Pam as well, and we kind of have outlined the next steps in terms of personnel committee job description review. But with both of these positions, we wouldn't anticipate hiring right at January 1. Likely with the treatment coordination, daytime crisis response, we're looking at maybe a mid-year hire. And I can say a little bit more about that. And then with the new position in public health, again, we'd probably be looking at Q2, bringing someone on in that position. But with the daytime crisis response and the treatment coordination, we're going to be having a conversation at the personnel committee later this afternoon about looking at a temporary project for one of our staff who is currently already working, providing a lot of treatment coordination type services for our outpatient population. And this was really in response to changes with adult mental health. Historically, that CD case management, inpatient CD case management was paired with adult mental health. Since we had a change in that position, we're looking at a temporary out-of-class appointment for one of our staff to take on more of a role in the big picture of CD case management and treatment coordination, to really look at that as a temporary project and make sure that we have a good understanding of what that position would look like before we post and hire for it.
So I know that you always tell your staff how wonderful they are, but just another big thank you because of the changes with programming and software and everything that Allison talked about this morning.
Mm-hmm.
It seems like there is a constant growth and change and flexibility and change and willingness in staff to take things on. And so that's huge that your staff is willing to do that.
Absolutely, yes. Thank you. I will pass that on.
It's the mark of a good leader.
It is. And I know that all of them want to support the community, but you can only do so much. And their ability to be flexible is amazing.
Yeah. We have a really strong team. Any questions about the staffing proposal budget changes for 2020 before I move on?
All right.
Okay.
Items for board action?
Yes. So just briefly, we'll go over the items for board action. I'll start with the addition. So the addition to the agenda is a subcontract for the Healthy Families America program. This is the new evidence-based home visiting program that Cook County recently entered into an expansion grant to join the rest of the 4-county Community Health Board in bringing this new program to Cook County. We are contracting with the Sawtooth Mountain Clinic to provide the service locally. Hannah Miller, who is the family home visiting nurse at the clinic, is, I believe, nearing the end of her very extensive training within this program. Due to some of the staffing changes within the clinic, we are looking at having Carleton County provide the clinical supervision rather than an additional nurse or clinical nurse manager within the clinic structure. So this is really one of the benefits of our Community Health Board, our regional structure that we have, that we can tap into the experienced nurses and resources within one of the larger counties in our CHB. We have a long history of partnership with Carleton County in providing this type of supervision of our staff, so we're really grateful that they're willing to provide this support to Hannah. Again, one of the components of the evidence-based program is that both face-to-face and using telepresence clinical supervision once she starts seeing clients. So the subcontract is just a shifting around of the grant funds that we received from MDH as a CHB, rather than granting those directly to the clinic to provide that clinical supervision in-house. We are contracting those out to Carleton County. Carleton County staff, CHB staff, and our county attorney have all reviewed and signed off on this agreement. So after, assuming you approve this agreement today, it'll go to Carleton County, and then we'll be able to start entering into that agreement for clinical supervision. We also have a request to establish a petty cash fund. This is new for our agency, but something we're seeing as an emerging need and a way to really prevent some ethical boundary issues for our staff when they're having to use their own cash in situations where they need an immediate need to access or to provide a client with cash as a part of their work duties. So the example that I put into the narrative request would be someone needs to do laundry. In a current situation, the staff person would be required to use their own funds and then be reimbursed. And there are some conflicts with that on multiple levels, assuming that a staff person has cash available to do that. Again, that boundary issue of using personal cash as a part of your job. So those kind of rare situations where an agency visa wouldn't be appropriate or wouldn't work in the situation, a check request wouldn't work. and it just prevents the staff from having to use their own cash. Lori is here and can address any specific questions. Lori has experience in managing a petty cash funds at other government agencies, so she's already been in contact with Brady about the steps for establishing the fund, what that would require in terms of setting it up in IFS, and then the internal controls to manage that fund.
And this isn't new to county government. We have petty cash in other places because when I need to get a beverage and only have a $10 bill, I know which office to go to to get change.
We also have under items for board action acceptance of an award from DHS to provide children's mental health services. This is just an annual process where we have to formally accept the award, and it funds some of the services we provide in children's mental health. We are also recommending that the PHHS board adopt the termination of debt policy for chemical dependency program fees. Again, this is just putting something into writing that we already have in practice to really just formalize and operationalize that procedure. Currently, we don't have a written policy for at what point we are able to terminate an uncollectible debt. And it's causing a lot of extra work for our staff to have to monitor that, and it's just not worth the time and energy for when a fee is uncollectible. And again, the situations are rare where we would have uncollectible fees. Where this most often comes up is if someone has a high deductible, maybe they have private insurance and they have to pay, but they don't have the funds to pay that high deductible, or if someone just doesn't qualify for one of the assistance programs. And again, this is just putting our current practice into objective written criteria. Under correspondence, and I'll let Jerry speak more to this in his report, but just wanted to let you know that we received a letter of support from the Public Health and Human Services Advisory Committee for the changes to the Cook County Tobacco Ordinance. So I've included that in correspondence. I'll also submit that for consideration at next week's public hearing.
Great.
I think that's everything.
So we will start with agreement for Healthy Families America. Does anyone have any questions on that? And that was the handout you received this morning. If not, I would be open for a motion.
I so move we adopt that.
I'll second.
Any discussion? All in favor?
Aye.
Any opposed? Sarah, all ayes. Next item is the petty cash fund. Any questions on that? I'll entertain a motion.
So moved.
Support.
Any questions? All in favor?
Aye.
Any opposition? All ayes. Next item is Children's Mental Health Screening Grant. Any questions? I'll entertain a motion.
I so move.
Second?
Any questions? All in favor?
Aye.
Any opposed? All ayes again. Termination of debt policy for chemical dependency. Any questions? I'll entertain a motion.
So moved.
Support.
Any questions? All in favor?
Aye.
Aye.
Any opposed? All ayes again. All right, before we get into committee reports, just a reminder, meetings to note, there's a public hearing for the Cook County Tobacco Ordinance November 26th at 9:30 a.m. And we will move into committee reports. Arrowhead Economic Opportunity, Dave Mills.
Nothing to report.
Okay. Arrowhead Health Alliance.
The only thing to report is that you'll be subbing for me.
I will.
Yeah.
That was
Thank
confirmed
you.
this morning. I'm kind of excited. I haven't seen Rick in a while.
We can connect via video in my office, Heidi, if that works for you.
You'll be,
All right.
yeah.
Arrowhead Regional Corrections, Robert.
Yeah, we had a meeting last Friday. Arrowhead Juvenile Center did a presentation on recidivism for their programming that they offer there, and the numbers are going down, so that's a good thing. And we're still in the director thing.
It's a good thing unless the building's falling apart and they need to remodel it. Then you don't get much support. All right, Arrowhead Regional Development Council, Ginny.
Yes, we met with great festivities. We had a commission meeting. Commissioner Deschamps was there. We had a little meeting for an hour, and then we reconvened over into Graceland Plaza for the 50th anniversary of ARDC. Great to really understand where they have been and where we're going. Attended by many, many people who were involved in the 50 years of ARDC, so it was a great celebration.
Awesome. Community Health Board, Dave.
Nothing to report there.
Public Health and Human Services, Carla and Jerry.
Carla.
Yeah, we met, I believe, on November 5th, and as Allison mentioned, I'm sorry, that was the other one. Never mind. I think the kind of the highlight of a whole bunch of new services available are in Grand Portage. And Paula talked about how they just completed their federal Head Start assessment or review, and it went very well, which is good. And it has been their goal, I think we might have mentioned before, to merge Head Start for infants on with the older children and have one continuous learning kind of program. And they feel very positive about how that's going to go. The other thing that I think is very good for mental health is they've been able to contract with a licensed Native American psychiatrist who will provide psychiatric consults, probably tell them that, I don't know. And this will also bring that cultural piece to the consult, so I think that's a very positive mood. The clinic also is going through right now, they were going through their evaluation with the federal government on some of their programs, and that seemed to be going well. And you've already mentioned ACEs, which they were pushing and did a good job with. And the meat, I think, is from Jerry.
Yeah, a significant part of the meeting was taken up in talking about the tobacco ordinance that you'll be looking at next week. And out of that, the main thing to say is that we have a very strong consensus in support of that change in the tobacco ordinance. And to that end, we decided as a committee that we wanted to advocate in a very direct way, including a letter from our committee to the Board of Commissioners. And if you don't mind, I'd like to just read that letter for the sake of the viewers and others that are interested. Dear Commissioners, I am writing on behalf of the Cook County Public Health and Human Services Advisory Committee to advocate for passage of proposed revisions to the Cook County Tobacco Ordinance that include increasing the age to purchase commercial tobacco products to 21 in Cook County. This matter has been a top concern of the Advisory Committee in 2019. We hold a strong consensus that the use of tobacco among young people represents a detriment to public health. We believe that this detriment can be reduced through a policy that limits access to commercial tobacco in its various forms by raising the legal age of purchase to 21 in Cook County. Vaping as an alternative delivery method for nicotine has emerged to an alarming degree among young people. In 2016 in Cook County, nearly 30% of ninth graders were using e-cigarettes. Reputable studies have shown that nicotine harms the adolescent brain and can establish neural pathways for addiction. Studies have also shown that raising the legal tobacco age raises the age at which teens begin to smoke tobacco products. These products are less likely to fall into the hands of students when their peers are unable to purchase them. Accordingly, the PHHS Advisory Committee urges and supports you in acting to adopt the Tobacco 21 revisions to Cook County's tobacco ordinance that are now before us. Sincerely, Jerry Vilja, Chairperson, PHHS Advisory Committee.
Thank you.
We also talked about other ways that our committee could be supportive to other, for example, the city's deliberations around tobacco policy. And I think we'll be having some other lobbying efforts arising from the committee in relation to that. But we want, next step is obviously this meeting next week at the county level.
Yep.
We also, in the committee, heard the very same report from Allison Plummer that you heard this morning, which was very helpful and well done, and we only wished we had more time to talk about it.
Mm-hmm.
Two things that are on our agenda are to prepare our year-end review of our actions as a committee, and we're going to need another month to get that, another meeting, since we only meet every other month. It'll be the January meeting that we finalize that. We're also needing to take an extra month to elect our chair and vice chair of the committee, as we had sort of a low turnout and ran out of time at this meeting, so.
Well, you know, whoever doesn't show up is the chair and vice chair.
Okay, that's it for the committee.
Okay, if you could get a copy of that letter so we have it for the public hearing.
Yeah,
It gets,
do you want?
Allison will take care of it. The next one is the Local Advisory Council for Children and Adult Mental Health.
Well, I think the main thing, in essence of time, is to say we were really all very struck with Jim Boyd's presentation on mindfulness meditation and how it's been used in many ways, but his interest is introducing it someday into the school system for children, and nationally there have been studies and a lot of articles written about that. For me, it was amazing to hear how many people on that committee already are doing mindfulness meditation. And so Jim really follows the work of Jon Kabat-Zinn, and he gave us, I thought, an outstanding presentation, and it really struck a chord as a possible project that this committee might want to take on and see to fruition. Again, we were missing because there were 5 at ACES, and so that's been tabled to talk about next time, but it seemed to be just a really a natural fit and an exciting thing. And I don't know, is there more you want to add?
No, it was a real, kind of
Yeah.
opened the window to the idea that this is something this committee could sink its teeth into to work on in some fashion or other to provide support.
Right.
And then we brought that discussion to the county's Safety and Wellness Committee about mindfulness. And then I talked about the mindfulness, the 2-minute book to do in the morning to write down your different things to set your mind for the day. And I already had a county employee email me and ask me where to get the book. So that trickle effect of how that goes on is wonderful. Healthcare Planning Committee, Ginny.
Yes, nothing specific is outstanding, other than Kay from Care Partners brought down to the West End a gathering of folks who had a discussion on how can we support each other, how can we help each other live a daily life and know what's going on. And they said, we don't know what's going on. So one of the things that they discussed was maybe we need some type of a calendar. And so when I went to townships, I said, you know, this is their concern. How can we find out what's going on in the West End? So Tofty said, well, you know, we have a website and we could post things that are going on at the school. And I'll be at Lutzen Township meeting tonight, so I'll spread the message there. So maybe we will start to communicate and find out what's going on. Not only the West End, but other places too.
Excellent. Emergency preparedness.
Well, we discussed some of the issues that are ongoing, and I thought the most helpful thing to me, at least, was we went round robin, and talked about some of the emergency issues, but also general issues of all the organizations that were involved, and we had a very good discussion.
It was good.
Excellent. All right, our last wrap-up item is for the good of the order. Does anyone have an item for the good of the order?
Yes, I would like to say
Okay.
that, for the last 3 years, I've been part of NACO, National Association of Counties, in the Health Steering and Health Policy Committee. And in order to stay current with them, you have to do two things. One is to attend the legislative meetings in Washington DC when you can, and also to participate in monthly conference call-ins. And wouldn't you know, this afternoon is one of them, so.
I thought that got canceled.
No.
Okay, I got a notice that said canceled.
I'll have to check, but not to my knowledge as of 10 o'clock this morning.
Okay.
They change times a lot, too.
Yep. Dave?
I went to the cannabis committee meeting on Friday, and House Majority Leader Ryan Winkler was there towards the end. Before that was Chris Tholkes, and she is the director of the medicinal cannabis program in the state, and that was very informative. Some surprises for the committee, and then the big takeaway from the meeting with House Majority Leader was, the thing that really struck me is where AMC has been coming from is that the legalization of recreational, or they're calling it adult use cannabis, is coming. So, and it affects counties greatly, so we need to be prepared. House Majority Leader Winkler said, it's coming, and it affects counties greatly, and we need to be prepared, or the state needs to be prepared. So it was just really interesting. He saw it coming from the federal level as well as from surrounding states. If there's states around Minnesota and it's coming into our state, it's still something that we need to deal with. Also, the impression I got is he thought federally it's going to be addressed. And so Minnesota needs to be prepared for that. And so it just really kind of changed the framework in my mind. But it seemed like in general we were on the same page, both the committee and that delegation, as to that this will be affecting counties significantly. A lot of the burden, if not all of the burden, will be on there. In the past, the kind of talk is like, oh, it's all about the money, it's all about collecting the taxes on it. And that really didn't come up. So it was just, it was mainly about social justice issues and criminal expungement, and how minorities are disproportionately criminalized, specifically with marijuana. And then also just being prepared. He said, as of now, there is no timeline, there's no deadline that we need to be ready by this point. And he says that's a good thing, because we really want to be ready for it when it comes. He also said that he wants to keep counties involved, and he fully expects it not to be, he fully expects it to be a bipartisan bill that will go through the House and the Senate and the governor, everyone on the same page. Which, boy, wouldn't that be amazing? Yeah. But that was his full intention. So it was just a really interesting conversation.
Was there any talk about T21 at the state level?
Not by him, but it was kind of brought up with the committee, but I think that was more brought up with the medicinal side of things. Just talking about chemical dependence, I think, but not with him. Mm-hmm. So.
Being approved federally is a good thing, so that it's regulated. There's so many people that use it medicinally, and you don't know what you're getting until we have the regulations in place to make sure that you better protections.
Well, that was so the state has 2 facilities for medicinal cannabis, and they grow, process, blah, blah, blah. They do everything in-house, and there's only 2. There are no, and there's state regulation there. there are no there's no financial regulation there, so they can set their prices, whatever. And so the patients that are using it pay between $250 to $1,000 a month. And the conditions that are covered under that continue to expand. And it's largely I guess exclusively evidence-based, the expansion of the whatever is treatable. So it's just really interesting learning about that. And you can, if a person claims that they have a condition that is not on the list, they can petition to put it on there, but they also have to provide evidence of how this helps, and which is challenging because of the federal restriction.
Those that don't qualify medically that want to use it because it does work, currently your options are
I see.
not monitored at all.
Sure, yeah, right,
So-
and that's not safe at all.
Yeah.
Yep. So, but it was just really, really informative, so it was good. But AMC said, okay, your obligation is complete. However, next year, we're thinking of some derivative of this group. If there's any members that want to continue on, there will be that opportunity.
'Cause it's moving.
But they're also looking for more members, so stay tuned, I guess. I'm sure we'll hear. They're hoping to have a booth actually at the annual conference. So
Great.
Good.
Yes.
Thanks for what you're doing with that and your time commitment.
Yeah. Yep.
And then I've got another item for good of the order. Some of you may know Stacy Drulard. She wrote a book, and it is Walking the Old Road, The History of Chippewa City and Grand Marais, Chippewa and Anishaba Way. And I probably just said that wrong because you just made a look at me. I was trying really hard to read this whole thing, so I'm sorry. On December 5th at Drury Lane at 5 p.m., she will be talking about her book, if anyone can make it. And so definitely something if you can look into or get the book and look at it. Obviously, Drury Lane will have it available. And so that is really great to have someone present the history and have it for us and have that community information. And then one last good of the order, unless anyone else has anything, is I am now officially a great auntie. My niece had a baby Samuel the other morning, so very exciting news.
Congratulations.
Yes, she made a lot of greats. There's lots of us. We like to reproduce in our family. So with that, I will ask for a motion to adjourn.
So moved.
Thank you.
What time will we pick up?
We usually pick up right now. I let us run late because we had so many good things to
'cause I
discuss,
need
and
to-
I wasn't task managing, so we will just go into committee of the whole after we take a quick switch
Because I have
around.
to do some stuff.
Yeah, you play with the video.